Hello, welcome back to Caring Nurse 101. My name is Christine. I'm an RN, I'm a coach, I'm a mentor, and an educator. I have been doing a series on the three most challenging things any aspiring nurse or new nurse should know before nursing school. The three challenges are academic rigors, clinical experience, and now today we're going to be diving into time management. Time management skills are very important when it comes to nursing school. Time management is very important in every aspect of life, but when it comes to nursing school, it is very, very critical, and you must learn how to juggle your time and prioritize the things that are the most important. Okay. Um, in a fast paced world of nursing, every minute counts. From the moment you step into the clinical floor to the minute you clock out, you'll find yourself juggling multiple tasks, prioritizing, and responsibilities. But fear not, for mastering time management is not only possible, it's essential for your success as a nurse. And once you learn and get your assignment and you start organizing your duties and learning what comes first, what is the most critical thing that you need to do first, and learning how to prioritize what is more important than other things. And then you will learn how to make out your daily task and learn how to finish your duties at the right time, at the correct time, and then you will be able to leave work on time. First, you need to prioritize ruthlessly. Identify the most important tasks and tackle them first, whether it's attending to critical patients' needs or completing urgent assignments. And that's what I mean. If you have a patient that is complaining of pain versus a patient that has difficulty breathing, or a patient that has a wound, surgical wound that's bleeding out, you have to use your nursing judgment and decide which one of these patients you should prioritize your attention to first. And if you chose difficulty breathing, it always trumps over any other issue that's going on with the patient, or anything that may be causing that patient any harm. But yes, difficulty breathing is always first on the list. Second, you need to create a schedule and stick to it. Block out dedicated time for studying, clinical rotations, and personal activities, and avoid the temptation to procrastinate or cover or overcommit. And that's something I had to learn how to deal with and when I was in nursing school and throughout life. But when it comes to nursing school, you're going to learn that you will change the way you do a whole lot of things in your life. And I learned to deal with procrastination, because if you're in nursing school and you procrastinate, you will find yourself failing. I had to put nursing first on the list. It prioritized over everything in my life. And I even trained my sons that my nursing studies came first. They would not disturb me. I would close my door. My friends would tell me, I tried to call you yesterday. Your son told me you were studying, and I told him that I needed to talk to you for just a minute. And he said, well, I can't do that. I can't stop her from her studying. Her door is closed. So yeah, you have to make your schedule and stick to it. And third, learn how to delegate. Nursing is a team effort, and knowing when to ask for help or share responsibilities can lighten your workload and improve efficiency. I had to learn that also in nursing school, or not in nursing school, but as a nurse. When you become a new nurse, you must learn how to delegate because you can't do it on your own. You have certain duties that you need to do, and you need to learn how to delegate to people that are working with you, such as nursing assistants. Um, you may you it takes courage sometimes, because a lot of times you don't want to ask anybody to do something because you feel like that person don't want to do it, but you have to be authoritative and learn how to and when to delegate duties to the proper staff. Fourth, you need to embrace technology. Use tools such as calendar apps, task management software, and alarms to stay organized and on track. And finally, you need to practice self care. Remember to prioritize your physical, mental, and emotional well being, as burnout can derail even the best laid plans. And that's very important, self care. I found that when I did meditation readings and just put yourself first, love on yourself, buy yourself something, uh, prioritize your time and take some time out to go shopping or go visit your friends, and just take a little time out, because nursing school is very consuming. You'll find yourself so consumed in your studies and you will get very burnt out. And perhaps the most important lesson in time management is to be flexible and adaptable. No plan is foolproof, and unexpected challenges will inevitably arise. The key is to remain calm, resilient, and focus on finding solutions. So, yes, you have to always be flexible, because even working as a new nurse, you have to learn how to uh, change up your routine that you do. Is nothing is going to be strictly the same way every day, and you got to make plans for something that may happen out of the ordinary. And time management isn't just about managing minutes and hours, it's about managing priorities, expectations, and ultimately your success. So embrace the challenge, perfect your skills, and remember that with discipline, determination, and a dash of creativity, you can conquer even the busiest of days. Thank you again for coming to Caring Nurses 101. That is the end of this series, the 3 challenges that every aspiring nurse should know. But next week we're gonna dive into something brand new. So tune back to Caring Nurses 101. Check out my website, www.caringnurse101.com, and you can find a lot of my books and resources, educational resources over there. And when you go to that website, you can sign the form and submit your email, and you will receive a new free ebook. So thank you, and see y'all next week.